The creative art therapies can help you decrease loneliness, help you connect better, and empower yourself more. So, and that's one of the many topics that is in one of Dr. Donna Betts' new book that she's here to talk about today. So, hi, my name is JD, and I'm a statistician and music therapist offering statistically significant support. And if you don't mind hitting those like and subscribe buttons so that you can get the support as it comes out. Hi, Donna. Thank you so much for coming onto the channel.
Hey, JD, thanks so much for having me.
As of today for this published video, your book is out and people can go see it. So I wanted to talk to you about it. What's in the book? But first, I know you're a creative art therapist. You're an art therapist by discipline. But tell me about yourself and tell me what led you to writing the book.
Sure thing. So in my, let's say, 30-year career now as an art therapist, and I've also been a university professor, researcher, published a couple other books, served on editorial boards for journals, things like that. And across the years that I've been in this profession, and also as a volunteer for my professional organization on boards of directors and so forth, I've really worked quite a bit and had my paths cross often with arts and health professionals. And these are folks who are not clinicians per se, but who are artists, often working in healthcare settings, for example. And there are organizations such as the National Organization for Arts and Health, where these types of professionals find their home. And I know a lot of our national organizations in the U.S., for example, have had interfacing with some of these types of arts organizations, arts and health organizations. And so really, this book came about bridging the creative arts therapies and arts and health toward inspirational practice is the title of the book. And it came about when I attended a conference that I actually co-coordinated in London, England in 2019. It was a collaboration between the British Association of Art Therapists and the American Art Therapy Association. However, we did have other creative arts therapists in attendance as well. And I did a keynote speech there on this very topic of collaborating across the silos, if you will, coming together, creative arts therapists and arts and health professionals, and how important it is to do that and why. And after my presentation, I was approached by a representative of Kingsley Publishers, Jessica Kingsley Publishers. And she said to me, well, what a fascinating presentation. Would you be interested in doing a book on this topic? So that's really how the book came about. From there, I proceeded to work with my collaborator, Dr. Val Huet, who is based in London, England. And she and I together, we had a vision for the book, which was we wanted it to have an international appeal, but because we wanted to cover a diverse array of topics that affect folks around the world who are working within or involved in some way with either the arts and health or the creative arts therapies. So that really is the intent of the book. And that's how it came about.
And I love that you talk about different cultures and how they use the creative art therapies in those cultures. But before we get to that, can you explain to me about how the creative art therapies treat loneliness, build connections, and help and empower people? So basically, what might a creative art discipline do to help people improve those?
I can say, especially JD, coming down off of, hopefully we're coming off of the pandemic. Hopefully we've gotten more of a grip on it at this stage. These are important themes that you bring up now more than ever. The idea of loneliness, empowerment, and so forth, and well-being, and how the creative arts therapies and arts and health practitioners can work together to support people and help them in those areas and others as well. Of course, dealing with depression and anxiety and all the other challenges that people have been facing over the last few years, people of all ages, really. So I will say that, you've got your clinical area and you've got your non-clinical area when it comes to this. And for example, one of many, I know that I definitely wanted to bring up an example that is in the book, one of our chapters on the Creative Forces Program, which is a program funded by the National Endowment for the Arts with support of Department of Defense and Veterans Affairs in the United States. A wonderful program that funds essentially the salaries of the employees who are sent out to work at our various the various military bases around the country. The program has art therapists, music therapists, and dance movement therapists currently deployed, working at these bases around the country to help the veterans and service members and their families. And as one example, I know they work in group contexts, they work in individual and in family contexts. And so in terms of, bringing people together and addressing loneliness and empowering them and alleviating depression, anxiety, and dealing with all the various other issues that these folks come to the table with, like post-traumatic stress, combat stress, like so many issues, and how these clinicians help the families address these treatment goals and just help them in general with their quality of life and their well-being through, again, the art therapy, music therapy, dance movement therapy, and so forth, is so important. And so these, just to differentiate the clinical work versus the work that's done by artists who are facilitators who go into hospitals and things like that too. So the clinicians are trained. They have degrees, they have qualifications specific to their field. They are regulated professions with scope of practice, standards of practice, ethical guidelines, and so forth, and work typically on a clinical team. Whereas you have your arts and health practitioners who are often, for example, like a musician who might go sit in a hospital and play harp at the bedside, or play a piano in a group room to the enjoyment and benefit of the people who are listening, for instance, or an artist who may sit bedside and help a patient facilitate a painting, which helps them feel better and makes them feel they've accomplished something and that kind of thing. So it's good for their self-worth, their quality of life, and their well-being. So even though these artists and healthcare practitioners aren't clinicians per se, because again, they don't have the training, that's a completely different wheelhouse. Nonetheless, there's huge benefits to having artists working in these settings, right? And same with theater. There's a lot of theater groups that will go in and work with people, and not in a clinical way, but in a way that supports their well-being and growth. So that's just to distinguish the two from each other. However, again, my book is about breaking down those silos that have existed between the realm of the clinical creative arts therapies and the arts and health practitioners, if you will, because I need to tell you a little bit about the background of this for context. When I say silos, what I mean is really, I'd say partly because over the last several decades, there have been some issues where, for instance, a hospital administrator who may not be aware of the benefits of a music therapist over a musician coming into their hospital. They may not be aware enough of, well, what are the differences between a music therapist and a musician, for example. So, once you can educate this individual and say, hey, look, here are the reasons you want a music therapist. They're clinicians. If you have patients that have any, for example, mental health issues, that kind of thing, you would potentially want to hire a music therapist because that person is trained to cope with the issues that may come up. Versus, you may also want to have a musician come in and play the harp or the piano, because that really is beneficial for people as well in a different way. That's not the person that you want to have come in and deal with a patient who's recovering from a brain injury, for example, and may also have post-traumatic stress, that kind of thing. You want to make sure you have the properly trained clinician in there. So a lot of, over the last several decades, there has been some confusion at places like hospitals, or forensic settings, or really anywhere where you could have a creative arts therapist and or an arts and health practitioner come in, right, and work with people. And so I think Val and I decided when we put this book together that it's high time for us to put all of that behind us, that it's time to look forward into the future towards how can we, instead of sort of being territorial, if you will, about, well, this really is a job for a clinician, not for an arts and health practitioner, and that may still happen in some places, but generally speaking, it's about coming together across, right, and working together to educate all these facilities and all of these administrators about, hey, look, you really do benefit in these ways from a clinician, and you benefit in these other ways from having an artist come in and working together to establish programs. Because JD, the bottom line is there will never be enough creative arts therapists to fill so many potential jobs, right? That are out there, and vice versa. There will never be enough artists or musicians or actors or you know uh, folks in the arts industry to go out and help people either. So if we all work together and collaborate, we really feel that that's the best way to deliver the arts for healing purposes to the public.
That is so eloquently said. This is such a huge topic in our field right now because um, oftentimes I'm told, well, no, we don't want to fund music therapy because we have an artist here, a musician here who's doing that, and that's enough. So, but you're saying that we need to come to work together. So, what can a creative art therapist do to work with an arts volunteer if they're in the same space?
Right, yeah. So there's a number of different things that can be done. And I think I will start by saying that everything in life is about relationships. And any successful venture comes out of a successful relationship. So for example, if you're a music therapist working in a excuse me, in a hospital, if you're a music therapist working in a hospital, and there is also a volunteer program that brings musicians into the hospital on a voluntary basis, just again to provide musical entertainment to some of the patients. There's a number of different ways that music therapists can engage the volunteers. And instead of kind of, again, operating in silos, I think it would best benefit patients by having the music therapist, for instance, take one of the volunteers under their wing and say, you're welcome to come and sit with me in this group setting that I'm in a group that I'm conducting today, and observe and perhaps assist with providing, handing out musical instruments and things like that, with the understanding that that volunteer and that individual wouldn't cross over into providing any clinical care. But there's certainly different ways, and also there are non-clinical ways that the music therapist can assist the volunteers. Creating a live performance. Some of the patients might be interested in playing some instruments together and putting on a performance in the main hallway, that kind of thing, and having the music therapist simply act as a co-facilitator with a volunteer in a non-clinical way. So again, it's about communication, relationship building, and as long as both the clinician and the volunteer are aware of their own scope of practice and so forth, then I think it could be a very powerful collaboration for the patient's benefit. And that's really, at the end of the day, what this is all about, is about helping people, right? And helping them ethically and keeping within our own wheelhouse of expertise. And that's really optimal for everybody.
So, what would you say are some of the pitfalls for the two working together, and how best can we avoid them?
Right. So some of the pitfalls could include lack of communication, the things that happen when the volunteer comes in and maybe isn't aware. They're huge, right? These institutions coming in, and the left hand doesn't know what the right hand is doing, and a volunteer comes in and sort of maybe is in a room with a patient, and the patient might say, "Oh, I'm really sad because my family hasn't come to visit me in a few days," and the volunteer who doesn't have training as a clinician we would naturally try to console the person, but if a person's really upset and perhaps negative thoughts and feelings are triggered, that kind of thing, a volunteer might not necessarily know the best way to handle that, whereas a clinician would. Um, if this happens and the volunteer knows that there's someone available, a counselor, or if there is a music therapist available, hey, this is a really hard. I can see that you're having a really hard time. I'm going to go see if the music therapist is in today. That kind of thing. So again, the importance of communication, the importance of everyone in the hospital understanding the roles, the individuals who are on staff, the volunteers who are available, and their backgrounds, and recommendations that are made in terms of really the administrative folks need to come in here. This is where they need to make sure that the left hand knows what the right hand is doing, right? To avoid those kind of pitfalls, to make sure that the people, again, are getting served the best they can. But one facility that we see a lot of this type of crossover in terms of like clinicians working alongside volunteers and so forth, or for example, would be a nursing home, long-term care facilities, where volunteers regularly will go in and facilitate a painting experience for some of the clients there, for example. And if you have there, unfortunately, again, we need a lot more. We need a lot more creative arts therapists in the world, and we need a lot more arts and health professionals in the world. And that's why sometimes you will find places where there are neither. Lots of facilities don't have good access of the arts to their clients, which is always unfortunate. Or you have a place where they may have an art therapist, which is great, or a music therapist, or a dance movement therapist, but not all three. Or you may have a place where there are just volunteers coming in and no therapists at all, which is better than nothing. Certainly, we want people to have, again, access to the arts for their health and well-being. If it is just a volunteer, there is a lot of good that person can do. But again, when you're working with some of these more sensitive populations where, memory care, dementia, Alzheimer's, things can happen where if it's a volunteer come in and is doing facilitating an art experiential, and a memory is triggered or someone gets upset, that kind of thing, they may have some basic training provided by the site in terms of how to deal, and they often will have other staff on hand that will help if something does go wrong, if someone gets upset or even has a physical outburst or something like that. But again, I will always say, I think every facility, as much as possible, should have a clinician, a creative arts therapist, as well as supplemental staff. And not even, a volunteer is great, but they could certainly also hire an artist and a health professional, right? An artist and healthcare professional. They can be hired as well and provide supplemental services, and also help alleviate some of the burden on the clinician in terms of helping to co-facilitate certain types of groups or putting an art exhibit together, that kind of thing. There's a lot that artists and healthcare professionals are able to do, even without training as clinicians. There's certainly a great deal they can do to work together.
So it sounds like we're talking about not loneliness, connection, and empowerment, not just within the patients themselves, but within different types of professionals as well. And you mentioned the Creative Forces Network that's really bridging the gap between the different disciplines, art and health, creative art therapists, but also other types of therapists, to help improve loneliness, empowerment, and connection. But that is a U.S. national program. But in the book, you talk a lot about international topics and how the creative art therapies are addressed differently within those. So as you were putting the book together, what was the biggest difference you saw between the different cultures and how the creative art therapies are implemented?
So the book really does, Val and I worked really hard to make sure, to the extent possible, within a certain timeline that we had, to be as inclusive of as many different types of arts engagement, as well as diversity of cultures in our book. I think we did pretty well with that. Our book is a little heavy on the art therapy side, again, likely because Val and I are both art therapists, and those are our main connections are through art therapy, but we do have some chapters that address all of the creative arts therapies and the various arts and health areas as well. In terms of how our book sort of shows the diversity across cultures. We have not just culture in terms of certainly socioeconomic differences, marginalized groups that are addressed, as well as just different cultures, in terms of multiculturalism, that kind of thing. So, for example, we have a chapter by Jamie Peterson and Allison Etter, and they worked in a forensic setting. So we have a prison population represented there. This is a marginalized group, of course. The setting is in the United States, and they really address how art and music, art therapy and music therapy, come together to support this population, also through vocational rehabilitation, and how through this work they help to reduce stigma, create community, and support development of social roles for that group, which again, very important. And we go from that to a chapter. We have a couple of chapters that address museum settings and collaborations in museums. For example, Rainbow Ho and Jordan Potash write about their work in Asia, and the use of the arts for social connection in that culture, and how they really worked with the participants that are cited in there in terms of how they increase their empathic understanding through the creation of artwork, and as a result change the attitudes of the community in a positive way toward otherwise stigmatized mental health populations there. And then we go to Greece, where we have a chapter by Elizabeth Ioannidis and Marina Tsekou, and they talk about their participatory arts program for socially excluded people, as well as those with mental or physical disabilities and other health issues like chronic pain and dementia. So again, we have such a diversity of population groups that are described here, as well as different cultural settings and considerations. Finally, just wanted to mention one more, a really lovely chapter on the development of the art therapy profession in India. This is a collaboration of Sangeeta Prasad, Susan Anand, Gurija Kaimal, and D. Sumathi. They talk about the history and development of art therapy in India. It's been quite a challenge to bring art therapy there, where you have a culture that has art teachers, but in terms of providing training to people there to train them as clinical art therapists, and overcoming some of the roadblocks they've encountered at the institutional level. And especially places, health organizations that have long-standing programs that are facilitated by artists. So so this chapter is really important in terms of how it addresses India and the challenges there. But we really think that the India example is a model for any country in the world where a profession has yet to be established, especially a creative arts therapy profession like music therapy, art therapy, drama therapy, and so on. If you want to create a profession in one of these countries, the challenges that you are likely to face. So that's really important.
And it's very clear in that chapter that they're building it from the ground up. Even getting it into the schools was a problem.
Yeah, exactly. So, but hopefully it's, again, I mean, if folks from around the world read this and they think, well, I'd love to see how we could develop, a music therapy program in our country, it really is instructive for what you would need to do that.
It's a fascinating book. Thank you for sending it to me. And thank you again for coming onto my show. We only have a few minutes left. So as we start to wrap up, are there any last thoughts or final comments you would like to say?
Sure. Thanks, Judy. Absolutely. Again, it's about breaking down the silos, and I have found across my career, when the national organizations come together, such as the National Organization for Arts and Health and the various creative arts therapies associations in the U.S., I'm using that example, but of course there are others around the world too. It's really important because look at we all go to Capitol Hill in Washington, D.C. once a year with Americans for the Arts, for example, to lobby Congress on Arts Advocacy Day. And we talk about, here's why Congress needs to raise funding for arts programming. Well, we know the benefits, right, of what we do, whether it's creative arts therapies or arts and health. More funding is needed to support programs. More funding is needed for research. These governing bodies and decision makers, they want to see research. They need to know that what we say we're doing is actually, we're saying we're helping patients. Well, how is that happening? And they need to see the research. They need to see the data that proves that or demonstrates that. So money is needed for that as well. And so you've got, advocacy is so important. Research is so important. and cross communication is so important. So if you're a creative arts therapist and you're watching this right now, reach out to your arts and health collaborators and join these organizations that need our support. And find out about research and go to Arts Advocacy Day. And there's so much that we can do as individuals to come together to make sure that more people can be helped by artists and creative arts therapists.
And more people need help from what we do, and they're needing it more and more. So this is a phenomenal resource, and I hope people actually go and read it. It's out today. So, and the link is in the description below. So please go and check out that book if you're feeling called. And if you found this video helpful, please hit that like button. And if you want Donna to come back, hit that subscribe button, because I know she has many books she can talk about. So again, thank you for watching this video, and please stay tuned for more statistically significant support. Thank you.